And we will now start the next session about aging, clocks, clinical aspects. We will start with Robert Maciejewski from Biolytica, the digital platform for biomarkers in longevity. Thank you so much for being here, and the voice is yours.
Thank you so much, and good afternoon, everyone. I have to say, yesterday afternoon or yesterday evening was quite interesting because I had some great conversations with many people who have arrived early. Very interesting conversations with people who are just interested in the topic, people who are actively in the field, people who are doing research. And also, unfortunately, I was talking to one of the organizers, and the organizer told me, you know what, it would be great if you would kind of do something for all of them. So if you can address the people that are going to be here today that are just getting interested in the topic and don't know so much about it, so they want to maybe learn something more basic, but then also maybe if you could have something for the clinics, it would be great, because some people are thinking about opening a clinic or they have a clinic, and that would be great. So I had the great idea, and I don't know if it was the good Irish air or the Guinness yesterday evening, to completely throw out all of my slides and start from scratch over lunch. So I just want to give you 3 ideas for better longevity. I hope there's a little bit in there for everyone. And then I also want to talk about what we do in 1 or 2 sentences. And I have to say, I have post-traumatic stress disorder from my life pre-longevity. Yes, there was life before that. There was a dark period in my time where I was working as a business consultant. And as a business consultant, you see a lot of slides with too much information and too many slides. So I really try to keep it short for the sake of my own health and longevity. I'm going to give you 3 ideas, and the 3 ideas are connected with each other. They are very basic, but I think it's something that's not talked about often enough. I travel to a lot of these conferences, and I talk to a lot of the enthusiasts in the room who are telling me about now all the supplements they're taking and the lifestyle interventions they're doing and the nutritional stuff that are changing and the exercise and the mental health exercises, and then the clinics who are talking about the great interventions that they do with their clients and all the strategies they develop and everything. And what annoys me a little bit about all that is there's one tiny but very, very important thing that I don't hear often enough. And that's really, really annoying. And I think most people ignore it, but I believe it's the most important thing when you talk about longevity. And it's great that we have, the amazing clinics that are doing all these interventions, and we have the supplements, and we have all the other things we can do. But the key thing, the most important thing that you need to do for longevity, for your own longevity, is this. Don't die. I mean, it sounds very, very simple, and it sounds a bit comical, but actually I'm very serious about this, because we're talking so much about, how can I optimize, which supplements can I take, which new molecules can I take, what other drugs can I take off-label to squeeze out some more years. But then when you talk to people and ask, when was the last time you did the full checkup? It's like, actually I never did one. Or like, what are you doing? What are the basics that you're covering to make sure that you're not dying of cancer, of cardiovascular disease, or other things? And it's quite shocking to me that this very basic thing is overseen so often, and even by clinics, I have to say. Because sometimes when you talk to clinics, you talk to them, and then you ask, what do you do? What are your strategies? And they give you these amazing plans, which all makes perfect sense, and that they're really well thought out, and they have excellent doctors in place, and they have excellent specialists in place. But then, they don't do the basic stuff. They don't check for risks. They don't check for medical history sometimes. They don't check for family history. They sometimes ignoring the basic stuff to just focus on the fancy stuff. So if there's one thing I want to kind of give on away for both the enthusiasts in the room and maybe the novices in the room and the clinics or people about thinking a clinic, don't forget the basics. We need to make sure that people live long enough to be able to benefit from all the things that we can do and all the amazing research that's going on that we've been hearing today and are going to hear over the next 3 days, because it's so important that you reach that age. And if there's things we can avoid, if there's risks we can avoid, then let's try to tackle them. Then the next thing I'm not hearing often enough, in my personal opinion, is about whole genome sequencing. So I'm sure many of you have taken a genetic test of one way or the other, And there's different tests that you can make. There's one that look at specific SNPs, which are maybe focused around certain longevity-relevant topics. You can do a full exon testing, and then you can do a whole genome sequencing, which we're looking at everything that we have. And one thing that is often talked about is, okay, we actually, now that's too much information, we don't need that. It's not that relevant yet. We don't understand 99.something% of the genome anyway, so it's too much. And I believe that's something that we actually should also look at from a different, more critical perspective, because when we talk about not dying early, in a way, a lot of what some people do is they're building a sports car and they make it look amazing, and they optimize the engine, then they optimize the oil, and they optimize the fuel they use, and they optimize the gearbox and putting on whatever. And then they sit into this car, and then they drive 200 kilometers, and they drive straight into a wall. And then they die, because they're not looking to mitigate the risks that might be seen if you look at your risks for cancer or your risk for other diseases that might affect it. And in a way, that's exactly what this could offer us, because genes are very interesting. I mean, seems to be a good understanding that roughly 40% of the differences in lifespan are genetic. And a lot of the topics that are relevant around that are a lot of the walls that you can drive into with your fancy sports car that you're optimizing all the time are things like cardiovascular diseases, that are things like immune system disorders, are things like neurodegenerative diseases, are things like cancer, are things like sleep disorders, are things like musculoskeletal disorders. So a lot of these walls that we have that we might potentially drive into really could be avoided, and you could drive around them if we would put more emphasis on really proper genetic testing. And I believe that's one of the things that's very, very important, and also for clinics. I'm not seeing that done to at least to my liking, enough, because I think if you want to support your clients, your patients, then you also want to make sure that if there is a wall ahead of them, if there is a wall of some cancer risk that you can uncover, that you can see, that you really can help them to drive around if we know it early enough, then you should tell them about it. And so that's why I believe it's very important. The other thing is this number, 70%. 70% of all the drugs that we take are metabolized differently from person to person based on your genetic makeup. So essentially, whatever drug we're talking about, 70% of them, some people need to take way less, some people need to take more to be effective. And so the one-size-fits-all approach that we have, not only with drugs, but also sometimes with supplements, really is something that we should reconsider, because pharmacogenomics, the information we can get about what specific drugs do you react better to or do you react to not at all, is very, very important in the context of longevity. And I want to give you one example. About 1 in 4 male people have a genetic peculiarity that they will not metabolize a specific drug very well that you get when you have a heart attack and end up in the hospital. I'm one of these people. So if I end up with a heart attack, hopefully not in a hospital, there's a very good chance that I will get this medication. And because I'm not a metabolizer, I cannot really metabolize this very well, it's not going to work. And that's not good. But it's not a big problem, because there's probably 10 or 20 other drugs that any hospital always have on stash, so you could just give you something else. So the thing is, knowing that I have this genetic peculiarity, what I did is just I carry around a little emergency card and have it saved on my phone that says, if I'm lying on the ground and I'm not breathing anymore, don't give me that stuff. It's bad for me. It's not going to work. And so that's very, very important. It's a very simple information. You do the test once, and you notice for the rest of your life. And not only will it show you, okay, what are potential diseases that you, with a very high likelihood, will develop in your life, but what are also things that you should avoid when it comes to specific medications, for example. So, and this is coming back to my pun at the beginning, don't die. I mean, that's all part of not dying. Knowing this information is part of not dying, because you want to know this information and you want to do something with it. The last part why I'm such a big fan of whole genome sequencing is it's future-proof. A lot of the tests that you can get right now in the market they are based on the science that we know at this point. So if you do one of the direct-to-consumer genetic tests, for example, they look at maybe 50, maybe 250 SNPs, whatever it is, and then they give you a nice report that looks nice. Okay, do this, don't do that, avoid caffeine, exercise more, exercise less, because you have a higher genetic ratio of recovery, for example. But that's all based on that point in time when this test was developed. And it will not give you any new information. And so if you want to have the most up-to-date information, you need to do a new test. You need to redo it. Whereas if you do whole genome sequencing, yes, we cannot do anything with it with most of that information, but as we all see in every single panel that we're looking at over these days, there's so much research going on. There's so much new information and so much information that might really be relevant and important for your longevity. And the whole genome sequencing, if you do that, that's the only thing you only need to do once in your life. If the information is stored away, if you have a great provider, and that's something we also do, every 3 months we send you a new report. We tell you, look, here are the newest developments in science, here's what you need to do, here's what you need to do to avoid. And you can get it for the rest of your life. So you do the test once, but you really have the assurance that whatever you do is going to stay, or you will be kept relevant all of your life. And that's also, again, looking at people who are looking into maybe opening a clinic, working with clients, working with patients. Take it into consideration. It's something that's really super valuable and super helpful for your clients to not let them die and do not let them drive into a wall. And the last point I want to talk about is use data. And I'm often, it's a mix between being shocked and surprised how many people, how many longevity enthusiasts just blindly take anything they can get their hands on. So they're taking 5 different supplements that are working on the mTOR pathway, and they're taking 75 supplements at the same time, and they're taking, doing all the stuff. And then when you talk to those people, say, how often do you measure? How often do you retest? Like, I just take the newest stuff, whatever it is, right? And I think that's not only stupid in a way, I think it's also very dangerous, because we don't understand a lot of the things already with very simple molecules and even simple vitamins and simple basic things. So just throwing everything at you without really understanding the data behind it is something that I'm very critical about in our industry overall. And I think we should really use and utilize the data better to make sure that we understand what we're doing, what we're changing in our body. So whether it's for yourself or whether it's working with clients, make use of the data, collect the data, store the data, and look at changes in the data. Whenever you introduce something new to your own diet or to your own supplement regime or to your own longevity plan, or whether it's for your client, measure the effect and look what's changing. And don't do 20 things at the same time. Do it one by one, but use that data wisely, because data can really give us an excellent way of improving the impact of any longevity intervention that we have, and make it more, first of all, more personalized. Everyone is different. We talked about genetics before. Everyone has different needs. Not the same supplement is not relevant for all of you. It might be detrimental for some of you in the room. It allows you to find the better dosing, for example. It allows you to see, does it work for me? Does it not work for me? Does it have negative effects? That can also happen. So using data, I believe, is the third thing that's really important when we talk about longevity and longevity intervention. But, there is a but. If we look at longevity and longevity data and longevity, what are the things we're talking about, right? We talk about things like molecules. We take different molecules that are promising to extend our healthy lifespan. We take supplements that can potentially extend our lifespan. We can take certain drugs which are off-label, whether it's rapamycin, whether it's metformin, stuff like that. We talk about nutrition. We talk about exercise. We talk about artificial intelligence for analyzing these things. We talk about lifestyle. We talk about what do we have? Exercise, we talk about habits that we need to change, we talk about mental health, we talk about genomics, we talk about biomarkers, we talk about aging clocks, we talk about multi-omics, so we talk about a lot of things, and honestly, it's all super confusing because there's so much information. There's just so much information out there, there's so much conflicting information out there, and honestly, if we want to talk about longevity in a very holistic way, in a very practical way, and I'm on the practical side of longevity applications, we need to understand all of these things. We can't just look at someone's, whatever, genomics and draw conclusions from that. We need to add to that, for example, other omics to understand it. We can't just look at someone's biomarkers and ignore habits of nutrition or other things. So all of these things we need to look at in combination, and it's very confusing. It's very, behind each of these words, there's a lot of stuff, and so I can fully understand how people are overwhelmed with the information out there. That brings me to the last point, what do we do at Biolytica? So at Biolytica, we have developed a health data platform, which mostly targets clinics, healthcare professionals, longevity centers, preventive medicine institutions, and so on, that want to help other people. And we allow them to have one tool where they can collect, visualize, analyze, aggregate all of this information in one place, and really create very personalized health journeys for their patients, guests, or clients, however you want to call them. So we collect all the genomics information, all the raw data, but also analyze the data, group it into certain pathways, whether it's certain genes are relevant for inflammation, for detox, and so on. We look at medications, and we can store that information. We can look at wearable devices. So the platform currently integrates with more than 500 wearable devices, giving us great insights on lifestyle, on the day-to-day things which are relevant to know. We look at diets. Diet is one of the things, of course, we all know that has the biggest impact on health, probably, that you can directly interfere with. But how do you track? If you work as a clinic, how do you track diet, right? You can ask people to do food journaling, write down all the food. I can tell you people will do it exactly 2 days. Then they forget about it. They lie to themselves. They're going to lie to you. So it really doesn't work. But no, everyone has a picture. Everyone has a phone in their pocket, so we can take pictures. And we can use the data that we get from these pictures to also look at patterns of eating behavior, for example, and take that into consideration. We look at all the standard stuff, the biomarkers, and track them over time. So we make it very easy for clinics to not only integrate with labs, but also easy to load historical data and biomarkers. And then essentially we do one thing. We decomplexify. Because all the data is very complex, all the data is very hard to digest, it's a lot of information, but we want to support everyone to make the decisions as easy as possible. And the essence of our platform is a dashboard which I would kind of like to describe. Imagine like the dashboard you have in your car, when it says, engine light is going red, or time for an oil change. So by using all the information that we have from the genomics, from the biomarkers, from other sources of information that we have, it becomes like an easy way to see, okay, where are the areas in your health that you really want to have a closer look at? So if you look at that, the full dots are all, for example, genetic information. Do we see high impact genes? So high impact genetically always means that if you do the right things, then, it starts this way. If you do the wrong things, things will go south rather quickly and will worsen rather quickly. But then if you make the right habit changes, things will also improve rather quickly. So we look at, okay, where do we see high impact areas that we need to have a closer look at? But then, of course, just the genetics is not enough. We need to have biomarkers. We need to look at, okay, where do we actually see issues with that person? And then it becomes easy to see, okay, maybe up there in the middle, oxidative stress, we see some medium impact genes, we see some medium impact biomarkers. So that's something to look at, but maybe at a later point, because we have a way more relevant issue, which in this case is, for example, detox. So maybe someone has very bad detox genes. For example, I'm one of the people, unfortunately, that has bad detox genes. I know that's never going to change in my life, but of course I need to look at my biomarkers. And if I have an elevated biomarker, so maybe some bad liver value, something like GGT, then I know that's one of the areas where I really want to start working on first. And yes, there's more things that I can always optimize, but to really avoid the more serious stuff immediately, I want to really take that and work on that. So that's essentially what we do. If anyone has any questions around that, I'll be sitting outside and in 2 days also joined by a colleague. So feel free to contact me as well. Thank you very much. And if there's any questions, let me know. Thank you.
We can take 1 or 2 questions from the audience now if somebody would like to. hands very much up. Okay, there is one question. Maybe keep the hand up because it's, yeah, it's easier this way.
Hello, thank you. I always say that the problem is not to have health data, is how to share health data, because we have health data for billions of people in the world, but we are not able to share it. So in, let's say, in your group, if people want to share their health data with other people, the other organization, is it possible? And do you share the health data of these people with scientists and so on? Yeah, that's my question.
So the question is around health data regulations. How many hours do you have? No, no. Sharing. So health data is a very sensitive topic, and we need to be very careful that whoever handles health data, not only us, but anyone else in the industry, we are really careful with the data, we are very protective of the data, and that we never share health data with anyone. That can never happen, because that's the most personal data that you have, and you do not want that to be shared in any case. So we put a lot of effort into not only that the platform is very secure, but we also all follow all the strict GDPR and other regulations that are out there. But what we want to do, of course, and that's why we're always interesting also in collaborations, and if you're in the field, we want to look at the data, because we want to look at the data and we want to generate knowledge from the data, and then we will share the knowledge, of course, because it's not about sharing personalized information. It's about seeing, okay, where do we see patterns that maybe, where there's interesting information out there that could be relevant for a wider audience of people. And then that knowledge is something that then can help a lot of people. And I want to give you one example, one practical example. We just have a new CEO on board who's very experienced in the field of genomics. And they did, a while ago, some research on the BRCA genes, which is the Angelina Jolie gene, which we all know leads to breast cancer in the majority of people. And I hope you're not laughing with the Angelina Jolie, the very, very medical and technical term that I'm using here. And what was found out, for example, was that if you have a specific variant of the gene, if you're from North America, Canada, as a woman, 100% you're gonna get breast cancer. No way around that. The same gene in an Asian population, Japanese population, 0%. So that's kind of the information that's really relevant and then really can impact, because obviously that gene leads to a lot of women then deciding on a mastectomy, so removal of the breasts, which is really a very heavy medical intervention, and of course very life-changing intervention for any woman. But if we know someone has a gene but is from a population which is not at risk, then that's knowledge that's very, very relevant, and that can really change lives.
Right. Maybe we can take one more right here. Short. Yes. Yeah. Question is about other types of data, like imaging or blood testing.
Okay. So on the platform side, any kind of biomarkers, any blood tests is very easy to integrate. We can store imaging data. At the moment, we're not doing much with it, because the whole topic of MRI data, analyzing MRI data, is something that's really so specific that it doesn't really fall under kind of our approach to longevity and data use. There are some excellent companies out there focusing just on MRI. Spending a lot of money on the analytics of that. So we can store it, but we're not doing much with it at the moment. But any kind of blood biomarker or any other biomarker is something we can easily ingest. Yeah, that's possible. Yeah. Yes, but I like the buts. The problem with publicly available data is data, in my eyes, is then most relevant if you have comprehensive, longitudinal, very deep and granular data sets, but from the same person. If I have 1 million data sets with genomics information and then 1 million with other biomarkers, that's great. And you can do some studies around that, which are relevant. but there's no connection between the biomarker data and the other data. So what we want really to gain more insights is data from the same person from all of these different areas, because that's where things become really interesting. So that's my short answer. Thank you very much.
Thank you so much, Robert. Really great talk. Lovely to have you here.